Good morning. This is a special call meeting of the Buncombe County Board of Education. I'd like to call this meeting to order and acknowledge that Max Queen and Cindy McMahon are joining us electronically. I'd entertain a motion to approve the agenda.
So moved.
Thank you. Could I get a second?
Second.
Thank you. So we have to call the roll to vote. Pat Bryant?
Aye.
Amy Churchill?
Aye.
Amanda Simpkins? Aye. Max Queen? I'll come back to Max. Cindy McMahon? Peggy Buchanan?
Aye.
And Ian Franklin, aye. Are we going to get audio from Max and Cindy? They're checking.
Testing 1 2 3.
Testing 1 2 3.
Good. Max Queen, we're voting on the agenda. Could I get your vote, please?
Yes.
And Cindy McMahon?
Aye.
Oh, good. All right, that's, now we're going to move to the Pledge of Allegiance. Will you please rise?
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I ask that you remain standing for a moment of silence. Thank you. You may be seated. At this time on the agenda, it's the action agenda, and this is the consideration for Buncombe County Schools Return to Learn plan, and I will turn this over to Dr. Baldwin.
Good morning, board and members of the public. We appreciate having you here this morning. I want to begin with what I believe to be a universal bit of very good news, and that is, unlike last year in the opening of the school year at this time, on August 23rd, all of our school buildings will be open for in-person learning, and that's significant. Likewise, we have a new option that's been created for parents and students, and that is a K-12 virtual academy, which is open for application. We have a tremendous challenge in front of us. From an academic recovery standpoint, this will be a challenge this year for us. We have a lot of work to do, and I'm very glad to report that we had a very successful summer school. Over 3,000 students that were involved in a 6-week summer school program, and from all accounts, it was very successful. So that's the news I want to begin with. And let's see, to move back to, I want to put our PowerPoint up. There we go. Need backspace here. Board heard me say this so many times last year, actually beginning in March of 2020, and that the single one constant that we faced as educators in our schools regarding the COVID-19 response was change. And so, once again, regardless of decisions we make to begin the school year, the potential for change is there. I'm going to present to the board and to the public 2 options for you to consider. We're going to also have some associated recommendations, both hopefully as a starting point for your discussion as you prepare to make that decision on what our schools will look like on August 23rd. So with that, I'm going to give you some data. Now, the first piece of data is from the North Carolina Department of Health and Human Services. And I'm going to start out by focusing your attention on the map in front of you, and especially the dates, because that map reflects the data from the state regarding COVID-19 from a 2-week span of July 4th to July 17th. In our business, it's all about timing, isn't it? Well, timing is such that the July 18th through the July 31st 2-week span is expected to be presented from the state sometime today. We have been diligently checking that since about 6 o'clock this morning, and I have to report to you that I don't have that updated map. But what I can also say to you is that it is my belief that while the early to mid-July, we found ourselves as a county in the moderate impact color-coded area, and you can see that there's a formula that those color codes are based on, and it's 3 essential factors: COVID-19 case rate, percentage of test positivity, and hospitalization impact. And that while we found ourselves, again, in the moderate impact, I fully expect, based upon the data that I've seen over the past 2 weeks, and certainly most recently, that we will find ourselves certainly in a different color with the potential for that, at least in my opinion, to be all the way up to orange and substantial impact. But again, that's the most recent we have from the state as far as the county map goes. Now let me show you a different version, and it comes from the CDC. The formula that they use at the CDC is a little bit different than what we're going to find with the state, and it's primarily 2 factors: the number of new cases and the percentage of positive rates. One key difference in the CDC map and the North Carolina Department of Health and Human Services map is that the CDC, or federal level, is on a weekly basis. So you can see the map that is in effect from July 28th to August 3rd places the vast majority, including Buncombe County, in a high transmission rate area. Again, that's CDC, and that's the most current map that we have. Let me give you some more specifics. And again, I've noted to the right-hand side that where the origin of this data is. And the 7-day case rate per 100,000, and again, this is from the CDC site. You can see that along with the percentage positive and the percentage of ICU hospitalization. The current daily percent positive for Buncombe County today that is showing is 7.2%. Now realize that's a daily rate, and that can certainly vary. In fact, I believe I'm correct in saying that yesterday, at the time that we pulled it, it was 7.5. So there's been a bit of a decrease in that, but it's a daily rate. Now, also included in the Buncombe County data, and I will say from my standpoint that I appreciate this board having the multiple discussions and the outreach to our public health experts, especially our local public health experts, for data and questions. And one of the questions that you sent into them and the response had to do with over the entire span of COVID-19, since March of 2020. Children under 12, which again is our key concern area because there is not an opportunity for vaccination for those children, that the number testing positive over that span was 1,277. Children under 12 hospitalized out of that group was 7. And again, that information came as a response to a question that you, the board, asked our local health officials. I would point out, when you look at that, though, that we do have to keep in mind that this new Delta variant that is being recognized as so much highly contagious, that really doesn't reflect the potential of that variant. But that's the information we received. Now let's look at the statewide data. And for that, went directly to the North Carolina, the State Department of Health and Human Services site. And again, all of this is accessible and available for the public. When you look currently at the daily percent positive in the state, that is now at 12.2%. I will tell you yesterday's equivalent percentage was at 10.8. So again, now we got to remember, this is on a daily report. And it only has to do with what that percent positive was for the particular day reported. The newly reported cases, 3,413. And then again, the most recent number that we have statewide for hospitalization is 1,580. One interesting piece of information, because I know this board has been very diligent in looking at patterns, because we know that there's fluctuations from day to day, right? But statistically looking over patterns, and what's interesting, again, even though it's a little bit dated, from July 8th through the 29th, look at the average, look at the increase in the average new cases per day. And again, this is a pattern that we are certainly seeing, that average continues to increase as we go through more recent weeks. So I think that again is the data that we're presenting to you today. And again, the sad part from my end is I think the county demographics, that may be another few hours before we see that, but certainly would be available to the public at that time. Let's talk about vaccinations. And I think as a county, Buncombe County can be quite proud of that. When you look at the entire population of Buncombe County that is eligible for vaccination, okay, that 67% of those citizens were partially vaccinated. 58% are fully vaccinated. Now look at the comparison from the state, and you can see we're well above those state numbers. And I think that's something we certainly could be proud of. Likewise, let's look at the newest age group that now has eligibility for vaccinations, and that's the ages 12 through 17. And you can see again for Buncombe County, that's 58% of those are partially vaccinated. When I say partially, that means they've had at least one of the vaccinations, or at least one particular inoculation. I think there are 2 with the Pfizer. Johnston is 1, and Moderna, I think, is 2. And then 55% are fully vaccinated. So look at the comparison again with the state, and you can see from the standpoint of the county that we fare very well in that comparison. Okay, you've heard me talk a lot over this full year span of the primary guidelines that all of us in our K-12 school systems across the state, all 115 of us, the primary guidelines come out of what's called the Strong Schools North Carolina Public Health Toolkit. And that is developed through the North Carolina Department of Health and Human Services. There's a collaboration with our own Department of Public Instruction. And fairly recently, approximately 2.5 weeks ago, we had some significant revisions in that based upon the data that had been accumulated from this past year. And so I want to point some of those out. It is not an inclusive list, but I think it does highlight the primary changes. First and foremost, it's the wording. The wording prior to these revisions were guidelines that clearly said that all school systems were required, and then beyond required, recommended. That language is now should versus required, and could versus recommended. And again, I think as everyone is aware across the state, that certainly puts a lot of the decision-making on our school boards. Field trips and assemblies can now be resumed. Again, those were part of the requirements from the toolkit last year, where we no longer had our field trips or assemblies. So they can now be resumed with, again, some caution in terms of our numbers and spacing. Students in small cohorts are no longer recommended. We had a lot of the pods, especially at the elementary school level, that were put in place. And the data, as they went back and looked at the data across the entire state, and remember, board, that each system in the state was required by legislation, by law, to report their data. And we reported that to an organization you've heard me talk about, the ABC Science Collaborative, which is a nationally recognized research center for COVID-19 data, especially the impact of COVID-19 on schools. And that's a collaboration between Duke University and the UNC Chapel Hill, both schools of medicine. So they had quite a bit of data, and from that data, then some of these revisions, I think, were, again, put in place. Face coverings, no longer recommended for outdoors, and that's pretty significant for us in our schools, especially with our outdoor recess, especially for our younger kids. Daily symptom screening is no longer required. For those of you that are parents that, especially at the elementary schools, you pulled up in line, had temperature checks, you had a screening list of questions that were asked, and that is no longer required for our schools. Social distancing, no longer required on our school buses. However, and again, this is guided by federal guidelines, not state, mask requirement remains for all adults and students on our school buses or school transportation vehicles. Okay, let me start with the first option, option A. And I'll say that the two options I give you today from our standpoint can be standalone. They can also be transitions from one to another. So if, for example, an option A is the initial decision, option B would be a logical transition, and vice versa. So keep that in mind. And here's our first option that we're giving to you, the board. And again, this is a starting point. And I will also tell you that we had teams, working groups that involved quite a bit of our principals and representation at grade levels involved in this as well. So this comes to you with a collaborative effort with our entire district leadership and school-based leadership. Face coverings will be optional while inside the school building for students in kindergarten through grade 13, as well as all staff. Now, again, some of you may say, well, that superintendent can't count because we only have 12 grades. Well, the reason that we reference grade 13 is we have an early college, which actually is a 5-year program from 9 through 13. So once again, face coverings optional while inside the school building for students in kindergarten through grade 13, as well as all staff. Supporting layers of mitigation practice within areas such as physical distancing, hand washing, cleaning, and ventilation will be prioritized. Remember, and we learned this over the year, that it's the combination of all these mitigation factors that give us our best opportunity to safeguard our students and our staff. Face coverings will, however, be required for all individuals, students, and staff while inside a school transportation bus or vehicle. The board reserves the right to issue a face covering mandate in the event that such a requirement becomes necessary in order to maintain in-person learning as a result of accelerating local COVID-19 case rates. So there's that caution that in this particular option, we felt is important to make sure our public is fully knowledgeable that there is indeed that potential. Because remember, as I started this presentation, change is the single constant in dealing with COVID. This mandate may be specified for individual schools, for individual districts. We have 6 districts, or for the entire school system. So that is our option A recommendation. Let's talk about advantages and disadvantages, and this is where our principals were extremely helpful because we hope they're healthy, but they were helpful because they ultimately, whatever decision that's made by this board, our school building principals are going to be the ones to ensure that your decision is put in place. And so it's boots on the ground. So we appreciated the comments that we got from them. So let's talk about the advantages of option A. The first is that it allows for more focus on academic instructional objectives, and it decreases the management piece regarding face coverings to some extent. It enhances the instructional effectiveness, especially for reading skills in grades K through 2. You can recall that we started early advocating for the face shields to be acceptable in regards to especially our primary school teachers and our students in the aspect of instructing reading, for example. The face shield was not approved as an equivalent, but again, this would allow that advantage to show. And then finally, it empowers parental choice. What are the disadvantages? It increases the potential for a higher number of quarantines. Now, let me explain that, and that's important for all of us to understand. Prior to the revisions in the toolkit and prior to a discussion of changes, the protocol for contact tracing in the schools with COVID-19 was that regardless of whether I had the mask on or off, whether I was part of a group that was quarantined or put in isolation once a positive case was determined, that was strictly dependent upon the spacing piece. Okay, we talked a lot about spacing last year, didn't we? Right? The new revision now puts an advantage to the masking for students. Now let me make that loud and clear. This is for students only. This does not apply to staff. But for students only, if those students are wearing their mask during the day, properly wearing their mask, and there is a COVID outbreak, those students wearing the mask, again, would not be subject to the quarantine piece or the isolation unless they exhibited symptoms. Now for us in schools, that's pretty significant. And let me give you an example. Last year, we were in Plan A, B, and C. We spent probably half the year, I'd say, in Plan C, which was entirely remote. That's actually how we started the school year, if you recall. Plan A was where we allowed back the in-person for those that had chosen in-person instruction. So during the time period last year where we had in-person instruction under Plan A, we had a total of 1,693 students that were quarantined. And we may have some parents in here that had a student that was part of that quarantine. If you recall, the number of days ranged from 10 days to 14 days before return, potential return. The number of COVID positive cases associated with those quarantines was 127. Now, from our standpoint, our concern is, especially as we're trying to recover our kids, because last year was challenging. I can't say enough about the efforts of our teachers, especially in the remote learning and virtual learning platform, because it happened so quickly. We adjusted. Our technology team had laptops in their hands in under 5 days. It was a monumental effort. So not to, in any way, shape, or form, put a negative, point a negative finger at the effort. But I think we all understand that there's a huge difference between remote on the computer for most of our students versus in-person, face-to-face teacher and student, okay? So for those 1,693 students that were quarantined, that equates to a considerable amount of instructional time lost. Now, we were able to pick them up on the remote piece, but again, the quality of the instruction. And again, that's why I continue to talk in terms of recovery. This is going to be a significant recovery year that began this summer. And again, a reminder that this applies to students only. Students ages 11 and under do not have access to a vaccine. And then the current guidelines from the CDC, North Carolina Department of Health and Human Services, and Buncombe County Department of Health and Human Services would not be adhered to fully with this option. So again, it's just putting the advantages and disadvantages, and I do appreciate the principals helping us with that. Okay, we're also going to include a recommendation for option A, if that's so the direction that the board chooses. And the district leadership recommends that the board's initial decision to operate schools for the 21-22 school year be reviewed at a minimum during each monthly board session in accordance with local COVID-19 data patterns and metrics. So that's at a minimum, that each monthly board meeting, we're bringing this data to you for review. As a benchmark only and subject to consideration of all relevant factors, the board would consider a change in plans if the following Buncombe County metrics were met, representing an increased risk of COVID-19 spread. And that is that the positivity rate for Buncombe County would equal or exceed the state average, and or Buncombe County becomes coded as either orange or red on the county alert map. Now, again, I apologize this morning because the county map that I gave you is not updated. And we got to realize, even when we receive it some point in time today, that we're going to be a week behind because it's on a 2-week span. So that map, those county demographics that comes from the state will be a key marker for us. Now, this isn't the first time that this board's seen a standard of metrics put before you. In fact, back in February, as the decision was not whether face coverings are option or mandated, it was a decision of whether we would be totally remote, whether we would be split in between, a hybrid, or whether we would be full in-person instruction, Plan A, B, or C. So if you recall, this board approved a similar type of standard to put out so the public understands that we are watching the data and that there is at least a criteria that would prompt a potential decision. It wouldn't force it. It wouldn't automatically happen. It would have to come back to the board for that decision to be made. So that's our recommendation to you, again, tied into option A. All right, here's option B. Face coverings will be required while inside the school building for students and staff in kindergarten through grade 13. Both students and staff may voluntarily provide proof of vaccination in order to be exempted from face covering requirements while inside the school building. Now, let me make this loud and clear. I have never, ever, ever, ever heard a member of this school board or a member of our school leadership team suggest mandated vaccines. Okay? Want that out there. And in this particular option we're presenting, that has to be voluntarily provided by the student or the staff member. So there's the option there. So you would voluntarily provide proof of vaccination in order to be exempted from face covering requirements while inside the school building. Likewise, an exemption is available for individuals due to a medical or behavioral condition or disability impacted by face covering usage. And that's clear language that's been in place since the beginning of face coverings being used, that there is that exemption that is there for, again, for medical or behavioral reasons. And that is option B. Okay, let's talk a bit about advantages and disadvantages of option B. Here's the advantages. And again, I recall the change in protocol that we talked about. That one advantage is it potentially reduces the number of quarantines, exposures, and spread of virus. Now, I want to point out that school system staff are not conducting the contact tracing. That is our school nurses, our experts in public health. That's what they do. That's not us. So we don't have control over that. Second advantage is that current guidelines from the CDC, North Carolina Department of Health and Human Services, and the County Department of Health and Human Services are primarily adhered to. Not fully, but primarily adhered to. What are the disadvantages of this particular option? Well, first, from an administrative standpoint, boots on the ground in the school, it does increase when we look at mass compliance. There's going to be issues there, and they're going to need to be dealt with at the school level. Secondly, there's administrative challenges associated with requiring the documentation. If those exemptions are exemptions in place, it requires some documentation. So, and then how is that distributed to those individuals in the school building that need to know? And then secondly, there's a disadvantage because of the limitations that come with the whole auditory learning piece. And the best example I can give you is in terms of teaching the reading, especially, where that's extremely important to hear that child and to hear that teacher clearly. So those are what, again, our team, including our principals, our staff here at the district level, determined as disadvantages. It's certainly not an inclusive list, but it does at least give you some food for thought. Then finally, last couple of days, I think the board's aware that we had our principals in here. This was our beginning of school sort of orientation. Our school board attorneys came in, did a presentation as they traditionally do, and then we had some good quality time with them. And I showed them this slide, and what I said is to our principals and our assistant principals is that this is the most important slide that I'm going to show you, because this is what we as administrators have got to guarantee. Because either direction this board goes, there's going to be some variance in face covering usage. Maybe one option is going to be a bigger variance than the other, but they're still in both of those because of the exemptions that are in place. It is extremely important that forms of bullying, harassment, or discrimination will not be tolerated relative to an individual's wearing or not wearing a face cover. That's going to be our charge. And again, that's important. That's extremely important. It now aligns and will align with, we've got a job to do in terms of academically recovering our kids. And that's the business we're in, people. Our business is instructing and teaching our children. But this becomes very important as well, because in order to provide a quality academic environment, every single one of our kids must feel safe. So this is extremely important. With that, I'm going to open it up to questions, and I do want to let the board know, and I want to thank Ms. Ellis Vaughn, who is on Zoom with us today. I believe, Ms. Swan, can you check, make sure, Mr. Pace, that she's fully on with us. She is the Director of Nursing for the Department of Health and Human Services here in Buncombe County. And again, I would just for the public to understand that our collaboration and communication with our local public health experts have been every step of the way in place when decisions have come to you about how we operate our school system. And again, in my meager opinion, that's extremely important professionally. And as a grandparent of 8 kids, that's extremely important to me as a grandparent to understand that you are doing that. So, Ellis, are you on with us at this time?
I'm here. Can you hear me?
She may have a muted mic.
I'm here. Can you hear me? Hello, test 1, 2.
Barry, we need to increase the volume.
Test 1, 2. Test 1, 2. Thank you.
You here? Okay, good. Ellis, thank you for being with us. I know you have a full plate in front of you as well. So with that, I'm going to turn it over to the board for any questions you have. Ms. Vaughn, certainly our staff here that's available.
Madam Chair, I'd like to start. Ms. Vaughn, this is Amy Churchill. I was wondering if you had any information, anything more current with regards to the percent positivity that you are seeing in those under age 18. Are you collecting any of that data locally?
Thank you. That's a great question. And unfortunately, I do not have that data specific to that age group. I can just say anecdotally off the top of my head, we are seeing now the average age of cases is coming down to around 39, whereas earlier in the pandemic, you may remember the age of cases was much older. So that is just telling you that now with this Delta variant and vaccines in play, we are seeing the age of cases coming down. And I'm sorry I don't have that specific positivity rate in that age group for you.
That's okay. I appreciate the update. I have been reading, there have been some children's hospital systems throughout the country that have been reporting increases in positivity rates for children 18 and under. Specifically, one in New Orleans that 5 weeks ago they were 4% positive and they are now 24% positive. I would venture to say that Buncombe County will not be immune to that increase in numbers. The other question that I have is, what are you seeing at our local area hospitals? I'm assuming you're still in close contact with the hospitals here in the region?
Yes, we are. I would say daily. I don't have specific numbers for you other than what is on the North Carolina DHHS site. And if you want me to pull that up, it shows our regional hospitalization rate. But we are absolutely seeing an increase, and they are putting measures in place in our hospitals due to seeing that increase in hospitalizations.
Okay, and fortunately, I actually do have some of that information. We, in our regional hospital, currently are full with our COVID beds, and we do have COVID-positive patients in our emergency department waiting on beds, as well as having many in our outlying hospital systems that if they were to become sicker and need transfer, that would also put us in a strain for finding beds for those patients. Just speaking anecdotally.
They can't hear you.
Okay.
Ms. Churchill, I think the
Sure,
mask is
I'll remove my
muffling.
mask. So I was just saying that actually. Aware.
Are there other questions for Ms. Vaughn from the board?
I have just one. Were you able to hear Dr. Baldwin's presentation?
Yes, I was.
So can you just expand on, because this is a big concern for me, the learning loss from a year ago and contact tracing once someone has been diagnosed as positive, for example, in a 4th grade class in some elementary school. As I understand it, and correct me if I'm wrong, if those kids in that classroom are maskless for that 6-hour day, and 1 or 2 of those children have tested positive, we've got a completely different issue than if those kids all had masks on in that 6-hour day. And as long as those masked children aren't showing symptoms, they would remain in school and not have to be quarantined. Am I accurate in that? And if I'm not, help me understand how that works.
Sure, and that's an excellent question because this is a change. And I just want to be really clear. The CDC recommendations, North Carolina DHHS recommendations, and local Buncombe County public health recommendations is for universal masking in all grades indoors. And one of the great benefits of universal masking is if you were to have a positive case identified in school who is consistently and correctly wearing a mask, any students, and this does apply only to students who are within contact of that case, if they are consistently and correctly wearing masks, do not have to quarantine. You're going to keep those kids in school. They just need to be observed for symptoms. Of course, if they develop symptoms, they would need to isolate and get tested. So, big benefit for wearing masks is the reduction in quarantine that you're going to see.
Thank you. And I think the thing we haven't talked about yet, and maybe it's coming, and it seems like so long ago, but it's really not that long ago, but in the spring when we brought kids back into school with masks, we still weren't dealing with 100% of our population. I mean, we're opening our doors for this school year for the ones that want to come, everybody. And last year, I think we stayed most of the year, Dr. Baldwin, with about 30 to 35% that were virtual for the whole school year. So at most, in those classrooms, on average, I know some would be higher and some would be lower, we didn't have full capacity. That 21 student elementary classroom may have had 12. I know the one that I volunteered at when I dropped by there and just to say hello in April at Johnston Elementary had 8. So it's going to be a completely different set of numbers, regardless of what we decide to do in each of those classrooms from K through 13.
I would say you're absolutely correct. It's going to make that physical distancing piece harder. And so that's why this multiple layered prevention strategies are really going to come into play. And of course, that's vaccine for everyone eligible, universal masking indoors, physical distancing as possible, screening testing programs, hand washing and respiratory etiquette, staying home when sick and getting tested, and then of course our isolation and quarantine when needed, and appropriate cleaning and disinfection of facilities.
That's all the question I had, Madam Chair.
Other members of the board?
Ms. Vaughn, you had mentioned the recommendation of masking for the students K through 12 while indoors. Children who are out for recess, outdoors, that kind of thing, am I to understand then that the masking is not a recommendation? It would too also be a choice if parents preferred their children wear their mask outside, they could do so. But then, of course, if they chose not to, that would be permitted as well. But would it still be important to maybe discourage clustering of the students and keeping them active and moving around on the playground?
Yes, that's a great question. You're absolutely correct. They do not have to wear it outdoors, but if preferred and they want to, of course, wear the masks. And this is where, you know, having our teachers help us in this situation. If they're noticing clustering of students during recess, that's where it would be like, hey, let's kick the ball, spread out, you know, encouraging students not clumping together in those clusters. But you're correct, they would not have to wear the mask outdoors.
Thank you.
I have a question. It is very apparent that the number of cases is increasing. When we look at that exponential curve and compare that to the rate at which hospitalizations are increasing, can you just speak a little bit to how those two compare to one another? Because when I compare those two, they're both very, very different.
Can you tell me a little bit more about what you're asking?
Yes, so our number of cases in the community is obviously increasing, and it is increasing rather quickly. But the hospitalization rate and the death rate is not seeming to follow that increase at the same rate.
I got you. Thank you for clarifying. And this is where I can say vaccination. Vaccination is key. That is what is going to get us out of this pandemic. And people who are vaccinated, while we will see breakthrough cases because no vaccine is 100%, unfortunately, but the protection level it gives people preventing severe illness, hospitalization, and death has been proven. So that's why, yes, unfortunately, with this Delta variant, we are seeing very high rates of transmission, but we're not going to see that extreme curve within those hospitalizations because we do have some people vaccinated, and we need to work towards getting everyone eligible vaccinated.
So that's the main goal here, is to get more people vaccinated. But if that doesn't increase, because ultimately, and I am vaccinated, and just so we're clear, but ultimately people have a choice as to whether or not they get vaccinated. So if we don't see that increase, it's just going to continue to be the recommendation in our schools that we indefinitely mask our kids.
Yeah, you know, unfortunately, this is still a novel virus that we are learning lots about, and we've already seen, you know, the variants have emerged. And if we don't get to a level of high enough vaccination, we're going to see emergence of other variants, and this pandemic could continue to look much different. And so all I can say is with a sense of urgency is please vaccinate. Vaccinate for yourself, vaccinate for your family, vaccinate for your community.
And I do just have one more question. So based on what I've read and the data that I've sort of dug into, it seems like it's the case that of the people that are currently hospitalized for COVID, over 99% of them are over the age of 18 and unvaccinated. So ultimately, there are adults that have made the choice to not get vaccinated. Is that correct?
I don't have the exact specific numbers right in front of me, but yes, I would say that the vast majority of people hospitalized are unvaccinated, as well as over the age of 18 at this time.
So the recommendation then is being based on what's best for the community, not necessarily what's best for our kids.
So I would say this recommendation for the community includes our children. Our children are part of the community. And I just want to state that Buncombe County Health and Human Services, our public health recommendation is the implementation of universal masking in all grades indoors and the implementation of all should statements in the North Carolina Strong Schools Toolkit.
And since the beginning of COVID, since COVID started, how many children in Buncombe County have we had hospitalized for COVID?
So I believe Dr. Baldwin had a slide on there from the numbers that we were able to pull, but I need to let you know that we are not always notified if someone is hospitalized. The only thing that is required to be reported to local public health is a positive lab. So we maybe get notified about that case, but then we are not notified if they're hospitalized. So we're not going to have exact specific numbers on that. The hospital system may be able to report on that, but I can't give you specific numbers.
So Mission doesn't report those hospitalizations. Our main hospital here, they don't report that regularly?
They're not required to report hospitalizations. They're only required to report to local public health positive labs.
Right, I understand they may not be required to. I'm asking if they do.
No, not directly to us, no.
Okay.
Mission Hospital does have a COVID dashboard that they do update, however. So it is something that the hospital does track. And I understand you're looking for specific numbers, which I can't give you, but I can tell you that yes.
Do you know how many, Amy?
I do not. But again, anecdotally speaking, what you are seeing is an increased trend. And we are talking about individuals who, especially under the age of 12, have not had an opportunity to become vaccinated. So the way that this virus seems to be working is that it will go to a host that is not vaccinated, and we can sit here all day long and talk about, you know, are there numbers, are they happening now? But at the end of the day, especially when we are seeing reports out of other cities that they are seeing increases, I think it would be very foolish of us to think that Buncombe County is special and will not experience that same fate.
Well, I think comparing other cities that may have a much less vaccination rate than we do, it is a little bit apples to oranges, so we do need a city that compares with us with regard to that.
Sure, perhaps we can get some information. I'll try to do a little digging to perhaps some areas like Winston-Salem and Charlotte and see if I have any connections there that might be able to share some of that information. But again, I just think you're going to start to see some increases because that's just how this works. Unfortunately, I'd like to say differently, but we are not alone in Buncombe County. We are not any different than these other areas.
No, I understand that. Early on in our last meeting, it was stated that during COVID that we had seven cases of children under 18 being hospitalized. And so I'm not sure why that number was released earlier and that number is being held back now. And so in that 16-month period, we're talking about 7 kids, and none of them passed away. I have kids, and so I understand that there is a risk, but ultimately there's a risk when we leave our house, when we drive our kids down the road. There's a risk in everything.
And I can appreciate that. And I'm not sure, I think maybe some of that data that you're talking about was posted at the state level.
I can, if you'd like me to clarify, that number was the number of hospitalized children in that age group that was reported to Buncombe County Health Department. So that's why I was saying it could be a larger number. Those were the only cases that we were notified that were hospitalized in that age group.
Mortality rate of our kids, but we cannot ignore that we are talking about more than just mortality of children. And yes, I understand that we live every day with a certain degree of risk. However, if there is something that we can do to mitigate that risk, for example, wearing a seatbelt, putting our children in car seats, looking both ways when we cross the street, and wearing a mask that has been recommended by multiple agencies as the one simple thing that has shown to help decrease the spread of this virus, then by all means, that is something that we need to strongly consider doing.
I understand and I hear that, but then I ask the question, so are we gonna do this every flu season from here on out? Because obviously it prevents the spread of flu as well. So are we gonna do this indefinitely every time a new virus is on the table?
I think it's very foolish to compare the COVID.
I'm not comparing COVID to the flu.
Vaccine,
I'm saying
but I
that
will
there
say
is
this.
risk with the flu, and are we going to wear the mask every flu season from here on out to mitigate that risk?
I would certainly hope not. However, I think that would be something that, you know, parents actually might consider as being a positive thing. But again, we are talking about 2 very, very, very different viruses, and you're comparing apples to oranges.
Well,
and
you compared it to looking both ways and crossing the street, so that the apples to oranges went down that path first.
You made the comment about there was a certain degree of risk in living, so I'm just pointing that out as how we mitigate those risks. But again, I will just say that we are sitting here, we have
taken up so much of our health experts' time since the beginning of this, and they are now actually giving us their very, very, very strong suggestion as to what we should do in order to have the best opportunity to keep kids in the classroom, which the last time I checked was the ultimate thing we were looking to do, was to provide a strong in-person instruction opportunity.
Okay,
and we
thank
are
you.
being told this is what we need to do to make that happen. So I'm not going to argue whether or not mortality versus sick. As far as I'm concerned, any sick child that we can help avoid getting to that point, then that is my intention to do my best to
All
help
right.
with that.
Thank you. And we understand Ms. Churchill's point of view. Are there, Mr. Bryant, do you have something that
I
you'd
was
like
just
to
going to
say?
offer, Madam Chair, I think, Dr. Baldwin, you meant this, but I would like to offer, if we
went with option B, or not plan B, option B was the way it was worded, or option B, or something similar to that we also have the school system put together something for the public that says, if we get to X, whether it's, I don't know what the number is, whether it's positivity rates, percentage of vaccinations, whatever, that, and maybe there's several steps. Maybe there's some number that those that are vaccinated, if we went with everybody being in mask, can take their mask off. Some number that says everybody takes their mask off. So I think it would be good if we were, as a system, regardless of which way we go, put something like that out there for the public so that they know what we're looking at to base those decisions on, regardless of which of these options we choose.
Sure.
That was all I wanted to add.
Okay. Peggy, you don't have any comments or anything?
You want to ask if there's any more questions?
Oh, do you have any? Listen, we appreciate our public health, and we appreciate the relationship that we have with you and the support that you've given us in making decisions. And I think this conversation today exemplifies the difficulty that you have as well as the difficulty that we have. And what we'd like to have is a simple answer, which does not exist. And but I do want to thank you for taking your time and being with us. Are there other questions from the board for Ms. Vaughn? Staff, do you have questions for Ms. Vaughn? Well, thank you. I mean, if you want to stay and listen to the deliberation, you are certainly welcome to do that, but we appreciate what you're doing.
Oh, well, thank you all, and we do appreciate the partnership very much, because we are all in this together. And I am going to hop off and jump on another meeting. Thank you again.
Ellis, may I ask a question of you before you do jump off? As a registered nurse myself and also pediatric advanced life support instructor, we were always taught our students that children are not just small adults. There's several anatomical differences between a child, particularly young children and adults. And one of them had to do with the airway and how such a small amount of swelling or any kind of damage to the airway could become very, very devastating to a child. And I just think, listening to the conversation, that we are so fortunate at this point that the COVID that we had been dealing with have not impacted children as much. We're not sure what the Delta variant may do or any other variant, but if it does affect children and into the respiratory tract the way that it has adults, would you concur that that would put that child at much higher risk and put them in maybe a more serious condition more rapidly than an adult patient maybe?
Yeah, that's a great question and point, Max. And I am not a pediatric specialty nurse nor a physician, but just from the knowledge that I have, I would agree with you that potential is definitely there, because yes, children are different anatomically than adults, bottom line.
Thank you very much.
All right.
Thank you all. Have a great day.
Thank you.
You.
Is there a member of the board moving the agenda? Is there a member of the board that would like to offer a motion at this time?
Is it your intent that we're going to vote on this morning or this at our evening meeting? Mr. Datley, maybe you can.
The board can do either. The board could just have a debate this morning. The board could decide this evening. But the board, this is a special called meeting, so the board may take action at this morning meeting.
Thank you.
And if we take action at this meeting, then it will be reported at the evening meeting, okay? All right, hearing no interest in a motion, I will do that. And I am going to make the motion that we as a board accept the recommendation of the administration for option A. And can I speak to that?
You would need a second first.
Oh, can I get a second?
A second.
Thank you. My rationale is that this option offers parents the opportunity to send their children to school with or without a mask, and that it is a personal choice. Knowing, and it specifically states in this option, that in the event that the matrix or the criteria or the numbers or whatever you want to call it increase to a point that we need to take other action, that it is in this option that what we would do and how we would move from optional to specific. And it would be based on data and that data coming from, I believe Dr. Baldwin has told us 3 different places. So it would be our responsibility as a board to mesh those 3 pieces of information and make that decision to move from optional to mandated. That's my rationale.
So just to be clear, to restate Madam Chair's motion, it is to accept the superintendent's recommendation for option A, which includes in that recommendation the slide in your slide deck on page 10 that the superintendent, or the page 5, excuse me, it's slide number 10 in the slide deck, the superintendent showed you, which would be as a benchmark only and subject to consideration of all relevant factors. The board would consider a change if plans and the following Buncombe County metrics were met. That's positivity rate equal or exceeds the state average, and or Buncombe County is coded as either orange or red on the state's county alert map. Is that accurate? What's your intention?
Thank you. So now we're open for discussion, is that correct?
Yes, ma'am.
Members of the board have discussion.
I have said my piece. I think people understand exactly where I'm coming from and what my thoughts are on this. And so I won't bore anybody with the details, but I cannot support this motion.
Other members of the board have comment?
Would not if option B were considered, would not the same parameter as far as making adjustments that I heard Dr. Baldwin speak to at the very get-go of this discussion, that it's a moving target? We've had this discussion last year. We went back and forth on it, and due to the numbers of cases that were being seen and that kind of thing, we had to tighten up from where we began to, well, we actually started strong, but then we lightened up because the parameters changed. And I think we're faced with the same thing. Again, we cannot predict the future of this. All we know that we're having some very high spiking right now, exponential spiking. And again, we're here on the 5th day of August with classes starting the 23rd, which is 18 days away. And I dare say that this spiking will continue, and we'll be looking at double-digit positivity rate by the time our classes are starting. And with that said, I think it would be better to go into this with our children masked, K through 13, And then we will be watching the status and the trending. And trust me, I want the kids to have a great educational experience in their classroom. And as the trending slows down, drops back down, maybe within the same parameters, and using those same parameters that you're referring to for Plan A, back off. But at this point in time, and looking at the data that we're seeing not only in our state but surrounding states, I think we're in for a rise here over the just the immediate future that we need to be prepared for, and not be at the last minute having to come back and say, okay, we can't do this. We're going to have to go to full masking. I think it would be best to start in full masking and then make adjustments as this crisis starts backing down again and we get it under control again.
Well, thank you, Mr. Queen. I read from that you don't support my motion.
You would read correctly.
Peggy?
I was just going to
Go ahead.
just offer that we hadn't heard from Ms. McMahon and Max, and to allow them to speak. That was all I was going to say before.
Ms. McMahon had to pull off and go
Okay.
to her work, so we're now with Max.
I would just add, Madam Chair, for me, my thoughts and how to move with this haven't changed. So as we were with AB days and partial kids in school last year, I was trying to get as many kids in the building as I could, with a mask on. And I'm the same way. As these two motions are presented, I would vote no to both of them, because I think there's a problem with the optional part in Proposal B. So I wouldn't support I can appreciate where you're coming from, and I understand it, but I wouldn't support that. I haven't changed. For me, it's as normal a day as we can have, with as many kids in the building as we can have, with masks on, until we get to some level of parameters. And I would like for us to, if we went that way, it doesn't sound like we're going to go that way, but if we went that way, for us to have, as soon as we can, this school system put out there for the public, here's what we're looking at. And when we get to this, the masks are coming off. And for us, because I think while it's important to follow national information, and we're not in a bubble isolated from the rest of the country, I think we really got to focus on what's going. We're charged with Buncombe County, and so if Buncombe is much better than surrounding counties or the rest of the state, then we need to function that way. Just as if Buncombe got much worse than surrounding counties or the rest of the state, then we should function that way too. So I would vote no to this motion. I would vote no to the way they're written. I'm going to vote no to both.
Peggy?
I support what, I support what Max was saying as far as voting for option B. And I base that on, and I appreciate what Ms. Simpson said about that you can't compare apples and oranges, but if you just look at trends and don't do actual comparison, the school systems around the country that have allowed what would be the equivalent of our option A have very high quarantine rates following that. And the other thing is, I guess I'm in a lucky position in that I have a sister who works with viruses and all that all the time. And in conversation with her this morning, I asked her, what about variants? And she said the more that it is just the nature of viruses to mutate, and that the more spread that there is, the more likely that we're going to have other mutations, not just the Delta, but other mutations, which we don't know. They might be fairly harmless and maybe, but maybe not. So I agree that, our goal here is to have all the kids in school without a mask, but at this time, I don't see that that's possible.
I think we've heard from everybody, so I'm going to call the question. Is that okay? Pat Bryant, and you are voting on my motion.
Correct, no.
Churchill?
No.
Simpkins,
Yes.
Max Queen,
No.
Cindy, she'll just have to, she can't vote. Okay, Peggy Buchanan?
No.
And Ann Franklin, yes. Well, the motion fails. So, where do we go from here, Mr. Attorney? Are there any other motions or any other things that need to be discussed here?
Madam Chair, I'll make the motion for, I won't vote for it, but it's been presented, and I think if we've taken one vote, we ought to take two. So I would make the motion for option B as it's been presented from the superintendent with the understood, Mr. Shatley, you helped me with this, with the understood caveat that as soon as this board and staff can, we come up with criteria that says, if this passes, here's where we are today, and here's what we're looking for to go in another direction, okay? I'm not comfortable with the portion of the presentation that makes it.
Can we get a second before you go into your explanation?
Yes.
Is there a
I'll
second
stop.
for Mr. Bryant?
Second for conversation.
Sorry?
I will second his motion.
Okay.
And the only thing for me is the portion about the for those that are vaccinated being optional. I just think we're going to run into, I mean, I just think right now about hallways in high schools, for example. A teacher's going to be able to enforce those kind of things in the classroom, but once the kids are moving around and going from class to class in the high school setting, I think that's going to be, it's going to be impossible to, and we're asking a lot already. And so for me, it's just that portion of it that I won't support, but I wanted to make the motion. We have a second so that folks can discuss and then get a
Okay.
vote. And if we don't pass it, then we got to do something else this evening.
Sure.
May I just kind of read back what I have and make sure you're in agreement? So, motion to approve option B is presented by the superintendent with the additional adage that as soon that the board and the staff develop criteria to move back to face coverings becoming optional. Is that appropriate for your intent? Okay.
Yes, sir.
One other thing I wanted to remind the board is that if this motion doesn't pass, that's certainly fine. That's up to the board's discretion. And you don't pass anything else tonight, if no action is taken by the board or approved by the board on the face covering issue, face coverings do become automatically optional. Because they're not
Would you say that again, please?
because they're not otherwise required. If the board adopts no action in regards to face coverings,
Yes.
they would become optional. Now, that doesn't mean you couldn't adopt something in the future. And certainly the board has the discretion to change. It's all within the board's decision. I just want to make sure you're aware of that. So if you don't adopt anything this morning or tonight, the administration will most likely move forward with making masks optional for the start of the school year because you don't have another meeting, at least right now, planned prior to the start of school year.
All right, is there discussion on the motion, the Bryant motion?
One question for Mr. Shatley. I'm looking at option A in the second paragraph, and speaking, it says the board reserves right to issue face covering mandate in the event such requirement becomes necessary. I think with the levels, as I mentioned, of exponential growth we're seeing now, that's going to continue, and going ahead and starting again with the mask in place, could we not just simply change the verbiage there in that paragraph and attach it to the Plan B and simply say the board reserves the right to decrease the usage of masks to a next step less, or maybe release the grades or ages 12 through K-13, or not K-13, but from ages 12 through high school, maybe reduce their wearing of masks if we had to continue with the children, or vice versa, whatever it may be. Would that not be reasonable? And I would ask Pat, would that satisfy your concern about the mask not really a mandate, but we're watching the numbers, we're watching them constantly. And I heard Mr. Baldwin say at the beginning of every meeting from this point forward that we would be updated on that and we could take action on it if appropriate.
Isn't that the essence of what my caveat was, I think, isn't it?
I think that's, I do, Mr. Queen, I think that's what Mr. Bryant was trying to put into his motion in such a way that will allow you to develop that criteria, since no criteria was necessarily presented. And so I think what would occur is if this motion passes, the understanding is that the staff will bring to the board criteria to automatically move to face coverings becoming optional in the school. And based on, and that could, I guess that criteria could be ultimately whatever the board desires, but such as if on the county map we go back to yellow or something of that nature. I'm just making that up. That's not what the board has agreed to. So, I mean, I think so, but Mr. Queen, you're certainly welcome to make an amendment to the motion. I don't know if I should have said that, but you are welcome. But I mean, the motion right now is that option B, and that the board or the staff and the board develop criteria to move back to face coverings becoming optional.
Max, were you saying you wanted criteria where masks would become mandatory and that for all as well? Is that what you're saying?
What I'm saying, Amanda, just again, I'm concerned about this spike that's going on, and I think it's going to continue for a while. And I feel very uneasy about putting kids at risk, putting them all in a very closed environment. I mean, goodness gracious, you look at the federal mandate about being so close on buses, and as Pat had pointed out, we're bringing back not a third of the children, because a third were distant, a third were planned or Schedule A, a third were Schedule B essentially, and we didn't have the capacity in our school. And now we're opening up 100% capacity, bringing all of them back, and at the same time, the spiking of the virus. And I just think it's reasonable and appropriate to approach that in a manner by which we're trying to protect those kids and our faculty and our staff. So I would say we had the criteria we had before when we were in last year, and we were looking at the different standards, the green, the yellow, the red, and as it got worse, we would adjust accordingly. And all I'm saying is, in preparation for that, starting early, I mean, we would be starting on the 23rd, and we would be meeting the following about 2 weeks later. And if the numbers are down such, we could drop down a level of mask wearing. Maybe we could exclude some groups. But I just think it would be prudent for us to enter with our eyes open. And again, I look at evidence from respected agencies, the people who are most qualified to give us the data, and it just seems like we're headed in the wrong direction. So that's why I feel like we should fully mask at the beginning.
So are you offering an amendment?
That's what, Madam Chair, that's what the motion is for option B. That's what my motion is, which is
rather than, I'm sorry, Pat, but rather than an amendment, Pat's right. That's why he stated. I stated a little bit differently, but I just want to make sure that we're clear on that we would be using that format. And it, you know, if it's a hang up on the verbiage, it seemed like you and Amanda, you know, really were looking at the ability to step it up. Well, I think my position is we are going to be seeing high numbers. So rather than stepping it up, let's just start protecting our kids. When we open the doors, we can always step it back down. And just so that that's in there, and if that's what everybody understands Pat's motion to be, I don't know if we need an amendment. If a little clarity would help, Pat may be able to restate his motion. Or I could certainly make that as an amendment if it's appropriate.
Just to be clear, because Mr. Queen, I think I don't want to get us all too hung up on just verbiage, but from my understanding, the motion is for option B, which requires face coverings for all students and staff, but allows students and staff to voluntarily provide proof of vaccination in order to be exempted, and allows for exemptions for medical and behavioral conditions or disabilities impacted by face covering usage, and that the staff and board will develop criteria for moving back to face coverings becoming optional. What I think I hear you saying is having criteria moving in both directions would be appropriate?
Well, you know, again, it ebbs and tides, it seems, and if we had criteria in September that said, hey, it's dropped way down, and we could lighten up and back off the mask covering, and in November, when cold weather starts affecting it and it trends back up, we have to understand it's moving target, and we need to be able to go either way. But I think in summary, I'm comfortable with Pat's motion. I just want to get more clarification that everybody understood before we voted that it would be the pleasure of the board to make those adjustments as we see
Absolutely.
data and the status of where we are at that time.
So I would offer, can I amend my own? I would offer to have the word both inserted, as in both directions, in my caveat, if that would help, so that we're covering. I mean, I think we all understand that, but if it would help so that if we wind up on a roller coaster throughout the year, I hope and don't think we will. But if that would help, Mr. Shadley, I'd be fine with that. So that the option is there. So the staff brings us recommendations that if things get better, here's what we're looking at to take the mask off. And if the masks are off, if things got worse, here's what we're going to be looking at to put them back on.
So you're welcome to make that amendment. It would need a second, then we would have to take a vote on the amendment itself.
I'll make the amendment.
Okay, so I need a second.
I think I heard Max second it.
And so the amendment is to the provision that the staff and the board develop criteria on when making masks optional. And Mr. Bryant, please let me know if this satisfies your intent, that the staff and board develop criteria on when masks are optional and mandatory.
Fine.
Okay. Not to be,
Okay. Sorry.
okay if I talk?
Yes, absolutely. Absolutely.
Not to belabor a point, but for my understanding, you are saying that you want to begin school with the requirement that all students be masked. Is that correct? Mr. Bryant?
My motion is for option B that was presented to us.
Okay, and that says
So
that
that we
all
vote on that after we've had the discussion of it.
I've got two people talking to me here. What?
It's option B as presented to us.
Right.
With the addition that the school system, us as a board, will make a decision before school starts as soon as we can of criteria for the public that if we move through any length of time dealing with this, that says, here's what we're looking at to take the masks off, and here's what we would be looking at to put the mask back on.
Okay, so to me, what you're asking, what your motion does is ask for clarification to where we're going to move. Is that correct?
Clarification on criteria so that we can present that to the public, correct.
Okay.
So the only thing before the board right now is the amendment. And so if there's no further debate on the amendment, I would suggest, Madam Chair, that we take a vote on the amendment. And again, the amendment is changing Mr. Bryant's motion to create criteria or develop criteria on when masks will become optional, and changing that to develop criteria on when masks are optional and mandatory.
All right, roll call vote. Pat?
Can I just have some more conversation on this? Sure. So, and this is where I'm going with this, Pat. I can fully support what you're saying with option B and having what I would say would be the same metrics as what we have listed under option A, and that would be to either ramp up or down as needed.
Debate is only on the amendment.
Okay, so that is what I'm debating with. The question that I have or request, and I don't know if this takes another amendment, but that would be to split into kindergarten through 8th grade to be mask required regardless of vaccination status for students and staff.
I would not suggest an amendment to the amendment. The last time I allowed you to do that, everybody got mad at me.
And I would not.
I wouldn't want that. I'm gonna leave that up to the superintendent and staff to bring us whether they feel most comfortable with splitting some things up or putting them together. That's going to be up to them, and then we'll debate it at that point when it comes to us as to whether we want something split or don't want it.
So are we, with this option B, the way that it stands then, are we giving that authority to administration to not only decide as a whole, kindergarten through grade 13, when we go up or down in our level of protection, so to speak, or?
That is not accurate.
No. That's not what
And
the
again,
amendment
the only thing on the floor for debate is the amendment. The amendment is to change to develop criteria on when to make masks optional, to develop criteria, the administration and board will develop criteria to make masks optional and when mandatory again.
Okay.
So I think your debate might come better on the main motion after we vote on the amendment.
Okay, I'm just trying to get some clarification on that. If we are allowing administration, with the way that it stands now, are we giving the authorization to administration to look at this from a kindergarten to grade 8 and 9 through 13 in their decision-making process, or does it have to stay whole as kindergarten through grade 13?
The way Mr. Bryant's motion and potential amendment are worded, it would come back to the board.
Okay,
At that time.
so then it becomes the board's decision.
Yep.
Okay. Thank
All
you
right,
for clarifying.
We're voting on the amendment. Do we need Mr. Shatley to read the amendment one more time?
Does everybody understand
I'm comfortable with it.
Does everybody understand what we're voting on?
Okay. Is that true? You understand? All right, Mr. Bryant.
Yes to the amendment.
Ms. Churchill.
Yes.
Ms. Simpkins.
Yes, since the option is there for masks to become optional, since we will have criteria.
Right. Mr. Queen.
Yes.
Ms. McMahon's offline. Ms. Buchanan.
Yes.
And I will vote yes because the option's there to allow masks to be optional.
So, Madam Chair, now we're on debate of the main motion, which is the approval of option B as recommended by the superintendent with the additional requirement that the board and staff develop criteria on when masks will become optional and mandatory.
All right, and we have had discussion, so I can call the question.
Well, I don't know if Ms. Churchill had more debate.
Well, I would just like to offer up a motion that we amend this option to state that face coverings will be required while inside the school building for students and staff in kindergarten through 8th grade, regardless of vaccination status, and 9 through 13 remains the same, with students and staff may voluntarily provide proof of vaccination in order to be exempted for face covering requirements while inside the school building.
Is this Mr. Bryant?
No, just needs a second.
Do I have a second for Ms. Churchill's motion? Hearing a second, her motion dies. So now we're back to voting on Mr. Bryant's motion. And so he gets the first vote.
As I said before, I'm putting it out there for the group, but I'm not supporting it. I'm voting no.
You're voting no?
I'm voting no because of the optional part for those that have been vaccinated. As I said from the beginning, I think we do a disservice. We've discussed this to not vote on this morning. I made the motion so that we could have the vote, but because of the one part of it, I'm not supporting it. So no.
Ms. Churchill?
Because we are not looking at the kindergarten through 8th being a separate entity in this option B, and it has been known that there's been spread from vaccinated to unvaccinated individuals, I will have to vote against this option.
Ms. Simpkins?
I vote yes.
Mr. Queen?
Yes.
Ms. McMahon's not here. Ms. Buchanan?
Yes.
Ann Franklin's yes. Okay, so it is,
Motion passes.
okay, thank you very much.
Passes 4-2, correct? 4-2?
Uh-huh. All right. Since that's the action that we have taken, I would entertain a motion. Is there other discussion that needs to happen?
Well, I don't know if I'm allowed to do this.
If the chair calls on you, you're allowed to speak.
Ms. Simpkins?
I would like to make a motion that, I
Go ahead.
hope I'm doing this right. I would like to make a motion that, and volleyball is the only sport that is impacted right now, but I would like to make a motion that masks are not required when the kids are involved in extraneous exercise. Can I do that right now?
Physical activity, yeah.
Yes, in physical activity with sports at the middle school and at the high school level.
All right, Ms. Simpkins has made a motion that that we not require masks to be worn during physical activity, particularly at the middle and high school level. Is that correct?
During athletics, so
Okay.
practices, games. That's what I'm making a motion on.
Okay. Do you have, is there a second? I'll second that. Okay, so now we have a motion and a second, and we're ready for discussion.
So I would just like to speak as a former coach and a former high school and collegiate athlete.
Speaking of that.
I can't imagine. I coached volleyball for years, and in the summer, the gym is anywhere from 70 to 80 degrees, if not hotter. Very often, we would have our practices at 7 o'clock in the morning, just so that the gym would be somewhat cool enough for practices. As a former travel volleyball coach, I know that these kids have been playing all summer long unmasked. I am totally, open to them being masked when they're in the huddles, when they're on the bench, when they're not involved in the athletic component of being on the court and going full speed. I think we maybe have a misconception, since volleyball's the only indoor sport going on right now, that maybe it's not aerobic at all, but that is far from the case. So I really think it's important for our athletes to be able to compete at their very best, and I think they can only do that if they have the option to not be masked. Certainly those athletes that want to wear a mask, they have that option, but I think it's very important that we do not force them to wear a mask when they are competing in both practices and game situations.
All right, thank you. Yes, sir?
Madam Chair, just a point. Again, I'm not in any way challenging that whatsoever for our Buncombe County students, but I want to make you aware that the North Carolina High School Athletic Association has adopted a policy that says if, for example, we go to a school outside of Buncombe County and they are playing under the requirements of masking, that we have to follow that, because that's the whole school. Just that caveat to keep in mind.
I totally understand that. I would want our policy to be that we don't require it.
When people come to
When people come
to us.
and obviously when we go, we have to abide by those rules of that particular district.
All right.
Dr. Baldwin, one other thing I would ask you, sir. Did I not see some recommendations coming out of David Ball's office that may have mirrored the North Carolina High School Athletic Association's guidelines for wearing masks for athletes? Does that exist?
At this time, I'm unaware of any other policy requirements coming from the North Carolina High School Athletic Association other than the ones that I referenced, Mr. Queen.
Yeah, the High School Athletic Association has indicated it's up to local districts to make the determination.
That's correct. They've not adopted any requirement similar to where Ms. Simpkins has gone.
All right, so to answer your question, Mr. Queen?
Yes, ma'am, it does.
Okay. Other discussion on the motion?
I have just a question, maybe for Ms. Simpkins or Mr. Shatley. I didn't know this was coming, so I'm not sure I'm comfortable. My initial thought is to support it, but I'm not sure in a short amount of time, would you be okay, and Mr. Shatley, could we move this to an action agenda item at our evening meeting so that I've got a little bit of time to digest it and think about it? Is that even doable, and or would Ms. Simpkins entertain that?
It's absolutely doable. So if the board would prefer to either by consensus or by motion set this for the agenda tonight, that would not be a problem.
So how does Ms. Simpkins feel?
Well, it would be nice to know if there are practices between now and then. But I would be open to that.
To move it to tonight's
Yeah,
agenda?
and vote on it tonight. That just so I can process that a little bit.
Okay.
My gut is I'm okay with it, but I just want to give it more than a couple minutes thought, if that's okay.
All right, I'm seeking consensus. Ms. Buchanan, are you all right with that?
Yeah.
And you are, Amanda, as the maker of the motion. How about you?
I'm fine.
Okay, so we will move that motion to the action agenda for the evening meeting. Thank you.
I'm in agreement as well, Madam Chair.
I'm sorry, Max, you're just a voice that comes from above. So would
You're fine, you're fine.
Thank you. At this time, I would entertain a motion to adjourn.
So moved, Madam Chair.
Thank you. Could I get a second? I heard a second. And then I have to do roll call. Pat Bryant?
Aye.
Amy Churchill?
Aye.
Amanda Simpkins?
Aye.
Max Queen?
Aye.
Cindy's not there. Peggy Buchanan?
Aye.
And Ann Franklin. We are adjourned and will reconvene at 5:30 this evening in this room.